students has been in an era of competency-based education, a technology-based education, a integration-based education. So all these are the new terminologies which have been coming up slowly, and we are getting used to it, acquainted to it. The question is not about whether the changes are good or bad. Never, the changes are never bad. We have to be there to accept it. But the most important thing is how do we adapt it to these changes. Because the changes is always there, shift is always there wherever you go. So where do we stand in this global movement? That is the most important thing. So we stand between the tradition, rich tradition, and innovation. So that's the outset of today's session, and why we want to look back to the global trends. Why we want to look at the global trends? Because let's reflect on how this it is important to look at the global development anatomy education, what has been taking place all over the world. Because I have identified few important things where these global trends are going. The first and important trend is the medicine no longer confined to the national boundaries, because it's becoming a globally interconnected now. And future doctors, what we are training today, must have training which should be that competent enough that will make them a globally competent healthcare professional. So through CBME, we have heard the word IMG, Indian Medical Graduate. We are preparing them as an Indian medical graduate, but where I feel so, he should be competent as a global medical graduate. So that's the first thing. What is the first trend? Second trend is that the generation change, what we are experiencing. Because the new generation, the students are very much digitally natives. They are the techno-savvy, we call them. They think, learn, communicate differently than the earlier generation was there. So their needs are different, they are grown up in a different environment. And thirdly, the educational research around the world, whatever is taking place, that is acting as the best guide for all the development taking place all around. Because this provides us with the powerful evidence on what works best and in teaching and the learning of anatomy. So, keeping these three important trends: number one, the global interconnectivity; second, the changing generation of the student who are digitally native, the techno-savvy students; and the educational research guides for the best practices are the three important trends. And by understanding these three trends, global trends, I will label it as a global trends. These are not only the Indian trends, these are the global trends. What we can learn, we can adapt, or we can innovate to ensure that our teaching remains both relevant as well as effective. Because our teaching is effective, and I'm 100% sure every anatomist take that all effort to make the teaching that effective. But it should be relevant also. Relevant not from I told you, not only from the Indian perspective, but from the global perspective as well. So these are the trends, and to reach to these three different global trends, we have to have some drivers of change. There are these 5 drivers of change, what I have learned from the literature, from my senior fellows, or from my fraternity, and from students also. These 5 global trends, first is the curriculum reform, not trend, driver. So that first driver is a curricular reform, where the shift is from normal medical education, a traditional medical education, to the competency-based medical education. And secondly, the integration of this anatomy curriculum in with the other subject curriculum. So we have learned about the horizontal integration, we have learned about the vertical integration. We have come across the 3 important parts of the integration in a CBME, like the sharing, nesting, and correlations. So all these are the curricular reforms. Nobody is talking about the anatomy in silo now. Everybody want to integrate the anatomy with some of the other clinical subject or the paraclinical subject like that. And this is how the curricular reform, the traditional and the today's, is been different. The second driver here is the rise of the technology. I will call it as an educational technology which has been evolved, like the virtual anatomy tables, the 3D models or 3-dimensional articulates, AR and VR simulations. All these are the revolutionary technology. Those are changing the educational technology. Once upon a time, getting a PowerPoint projector in department was a technology. but nobody call it as a technology. No, it's a need. And what is technology? These are the technology like the virtual table, virtual dissection table, 3D model, AR, VR, simulations, and that brings the anatomy to a life that take the student beyond the dissection. Initially, whole of the anatomy teaching was with the either with the hall, dissection hall, or with the histology or department, or within the anatomy department itself. Now it is beyond that all because of this all educational technology. Third thing is the efficiency needs. Reduce contact hours. Yes, the curriculum is so condensed. Not exactly the curriculum is condensed, the hours has been condensed. The curriculum remained the same when initially it was for the 1.5 year, reduced to the 12 months, reduced to the 10 months, now effective teaching remains 9 months only. And this is the preclinical phase where it is forcing the anatomy teachers to find more efficient and engaging way to teach. So this reduced hour has necessitated us to anatomy teacher as an efficient teachers in a available span of time, whatever the time is available with us. The fourth driver, what I would like to quote most important is ethical and logistical challenges. Yes, those challenges are there, ethical and logistical challenges because of the shortage of the cadavers. The cost of maintenance, the evolving social and legal attitudes toward the body donation, which is the one of the most important hurdle what we can face today, what we are facing today. And because of this, all these things, shortage of cadavers, the maintenance issues, the legal and social attitude toward the body donation, we are facing much issues in having the cadavers in the body dissection tables for normal dissection. Some of the colleges may be having good cadavers, but I definitely know there are certain colleges, especially new colleges, which are facing the challenges of getting the cadavers. And finally, the fifth driver is the global collaboration. There are the n number of international associations, there are the conferences, what are be taking place all over the world that connect the educators, that helps them to share the resources, share the innovations and the research practices among each other. So some of the tables are dissection table, they have their collaboration. For example, one of the table is anatomist table. They have anatomist community throughout the world. So through this community, you can share your ideas with the fellow anatomists of the Western countries, to the Eastern countries, to the European people. So these are the chances. There are the n number of collaboration, global collaboration that can be introduced. And these are the global drivers of the change. So starting from the curricular reforms to the global collaborations, passing through the rise of the technology, reduced contact over ethical, logistical challenges. These 5 are the main drivers that will take us to the change of anatomy. Now, there is a shift from the dissection hall to the digital. Everybody will agree with me. This is a huge shift. Every senior anatomist here that will definitely feel that. Because this traditional dissection remains the vital for the 3D understanding of the structures. And that was the dissection was only considered as the gold standard of anatomy education, where both the terms anatomy and the dissection were inseparable once upon a time in centuries. And that dissection used to give a 3-dimensional understanding, respect to the cadaver, teamwork among the peers. Those were the additional advantages of this dissection. But today, when the digital learning has entered into the arena of anatomy education, or I can say the medical education, with the incredible force, and now we have the virtual dissection table, 3D anatomy visualization software, augmented reality, VR set, AR set. Now there comes the AI, artificial intelligence. So with all these, students can rotate the organ, they can view the layer by layer, they can trace the nerve pathways. Even minute surgeries can also be performed by giving the simple incision, layer by layer dissection, or layer by layer removal of that particular structures, all from a screen, a digital innovation. However, and this is crucial, the digital tools are never replacement to a dissection. It can be complementary to it. So goal should be a hybrid approach of dissection as well as the technology enhanced dissection. So the dissection, whatever the dissection gives the tactile experiences, the emotional connect with the cadaver, the sense of gratitude for the cadaver that comes from working together with human donor, that cannot be replicated by technology. Technology will not give all these feelings. So globally, whatever the global trend is there, but my thing is that it should not be a dissection versus digital, but it should be a hybrid model, what I told initially. So there should be a hybrid model of anatomy education, blending the physical dissection with the digital methods, with the other methods. So we have to make the shift from dissection to digital, but not entirely from dissection to digital, but keeping it a hybrid model. And to understand this hybrid model, there are certain technological innovations which are available worldwide now. Even India, we are not far behind of that Western world. Because in the United States, there are certain schools that uses a holo anatomy, a sort of, that's a brand name, holo anatomy. It's a totally AR-based anatomy course. And run by the American people only, because the American have the Microsoft company. This is developed by the Microsoft only. Microsoft HoloLens is the brand name over there that runs this holo anatomy. You can have a AI-based anatomy learning over there in United States. In Australia and Canada, there are departments use the blended model of combining cadaveric dissection with the virtual tools like complete anatomy or the visible body, which what we are also using in anatomy in the anatomist in India. In the Britain, there are some schools that uses the digital cadavers. Absolutely, digital cadavers are used most of the part of the Britain, because there are the shortage of cadavers. Already the population is not there. How the cadavers will come like? So VR labs are there in different parts of Singapore, like a routine teaching, because they don't get the cadavers. And these innovations, whatever the different innovations are there, technological innovations are there all over the world, they have made the learning more interactive. The students are happy. You ask the student to get them, just give them names of two important anatomy apps which are available free of cost on the Google Play Store. They will download the app and then interact with the student how they are using this app. They are very happy because the students are of that particular mindset. They are more technology oriented. Instead of keeping that time into the dissection, if you give that time to these people to go to the VR lab, AR lab, or the anatomy gaming, they will be more happy of that. So, but again, the most important thing is that the global message that remains clear is that the technology enhances the learning, and it cannot replace the human mentorship. The cadaveric dissection cannot be traditionally replaced. So I'm using that word again and again. I'm using that line again and again with the different context, that the anatomy cannot be only technology driven. We have to take the advantage, you have to take the help of traditional dissection methodology. Those are the most important. So coming to that first thing, what we are we were talking about the curricular reform and the integration. Because the medical curriculum across the world is becoming a competency based. Basically, this competency based medical education started with the Western world, and we always follow the Western world, like the Indians. So we also adopted the competency base because we want to be a part of WFME, World Federation of Medical Education. And with the pressure, the global pressure, we also accepted that competency based medical education. We called it as the integration based medical education. So instead of learning anatomy in isolation, now we want student to learn in context linked to the physiology, where we call it as a horizontal integration. We want to link the anatomy with the vertical integration, with the pathology, the radiology, the surgery, the clinical cases everywhere. So all these traditional divisions of the preclinicals and clinical years has been blurred now in the most of the Western world. They don't call it as anatomy as a preclinical subject, now they call it as a clinical anatomy. They call it as a surgical anatomy. And students are exposed to the patient right from their first year. What again we have started with the NMC, with the competency-based medical education, we call it as the ECE. Early clinical exposure we started. So promotion of the ECE through integration, through the skill-based learning, all this is taking place as a part of a curricular reform, making the anatomy education in India of a global standard. So the global emphasis has been shifted now, especially in anatomy education, from memorization to application. So when I was a student here, just to memorize the anatomy structures, memorize the muscles and all, that was a tradition. But now it's the application-based questions are asked, especially in the now new curriculum of the next, what we have been guided by the NMC. It's application-based question. So the shift is not only from memorization to application, the shift is from the knowing the anatomy to the using the anatomy for clinical cases, for the surgical cases. So that shift from the knowing anatomy to the using of the anatomy for clinical cases is the most important aspect of the curricular reform what has been taking place. We want to take that reform, we want to be the part of that curricular reform. But we cannot forget the role of the dissection. Technology कितना भी बड़ा हो जाए, कितना भी advance हो जाए, the anatomy educators will not give up the anatomy dissection, cadaveric dissection. That is irreplaceable. Yes, it teaches much more than the structures. What we learn, all the senior people, faculties will have join the word with me that we call the cadavers as a silent teacher, the first patient. The silent teacher mentorship program, a gratitude ceremony is carried out. So I have put up one picture of a gratitude ceremony what we conduct at our institute level, where the student pay gratitude to a cadaver who was the first teacher, a silent teacher. So that modern dissection now has to be combined with the imaging and ethics. That's why I am saying the preservation through the modernization, that retain the dissection with the imaging tools, ethics, and all this becomes the part and parcel of the role of a dissection. So you cannot replace the dissection, you have to combine the dissection with something else. And when we talk about this, not only the dissection or the curriculum is important, but the assessment is also important. Why the assessment is important? If you put the thing only in the curriculum, the student will only learn it. But when you say the curriculum में ये topic है and the assessment will be done on those topics, the student will understand it very or listen to it very carefully. Because always assessment drives the learning. Whenever I take the lecture, I tell the student, yes, before starting the lecture, in the beginning of the lecture only, I tell the student, yes, today's topic is popliteal fossa. Question asked on this are long question, a short note, or the MCQ. Describe the popliteal fossa under following heading: boundaries, content, roof, floor, applied anatomy. So when you tell in the beginning only that this is this topic is going to be a part of assessment in the theory examination or the practical or the Vaibhav examination, student becomes more attentive for that. So anatomy assessments are moving away from traditional things like the recall and identification to a competency-based assessment. Because the old practical were just to identify the muscle, identify the nerve. Now this has been changed by the different assessment methods in anatomy, like the OSPEs, objectively structured practical examination, what we follow in anatomy. There are the case-based or the image-based discussion. The radiological questions are there. The different type of the application-based questions are there. And that the direction where the assessment is taking place differently in a worldwide manner, the global manner, towards the more relevance of anatomy and the application of anatomy to the clinical setting, what we was talking about, the integration, vertical integration across the phases. So what started the change was the curriculum, but the change in curriculum was again reflected or has to be reflected in assessment. Changing the curriculum, changing the syllabus is not going to solve the problem. Assessment should be there like that only. So that's why it is there. So curriculum bhi ho gaya, assessment bhi ho gaya, but are those faculties that competent to handle all these things? Where do the faculty stand for this? So the faculty has to stand somewhere. And the global trend is that the faculty development is the key. Whenever the NMC started with the new curriculum in 2019 CBME, they started so many faculty development program along with it. CISP was introduced, Curriculum Implementation Support Program. CISP Part 1, Part 2, Part 3, respectively for first year, second year and final year faculties. So this is important aspect, faculty development. Without faculty development, a good, nicely developed curriculum or the assessment method will not work in a actual. There are certain international bodies like the American Association of Clinical Anatomists, International Federation of Association of Anatomists, or the Anatomical Society, or the other societies worldwide that run regular workshop, conferences, online modules to teach the faculty in different pedagogies. like the digital pedagogy, the integration strategies, the research in anatomy education. So the faculty development remains the cornerstone of effective upliftment of medical student. अगर फैकल्टी ही उसमें ट्रेन नहीं है तो मेडिकल स्टूडेंट का अपलिफ्टमेंट होना बहुत मुश्किल हो जाएगा. दैट्स व्हाई वी वांट द फैकल्टी टू गेट come forward for this change. They have to accept this change. The educators has to be a facilitator, not only the content delivery boy. Just delivering the content to the student is not going to solve our problem, because the content can be delivered to the student by a variety of other means also apart from teacher. The student have access to the YouTube, student have access to the various Marrow notes, student have access to the various access medicine from the McGraw-Hill. There are the n number of lectures and beautiful lectures with the animation and everything is available with the students. Then why they will come to the teacher? But they have to they will come to the teacher not only as an educator but also as a facilitator. So we have to be acting as a facilitator. So this is the new generation of anatomy educators we have to bring out from ourselves within. Not just who is the content expert, but also educational innovator and educational researcher. So as a faculty, we must move away from teaching anatomy to facilitating the student to become them the designer of learning experiences. Whatever the learning experience we are giving to the student, that is to be designed in a such a way that student will feel it happy to accept that. That's why the training in digital pedagogy and integration is the most important part of a new global trend of anatomy education. And we cannot remain away from that. Whatever the big anatomist we are, whatever the senior anatomist we are, but we have to be a part of faculty development. We have to come up, we have to learn with this all integration, we have to learn all this technique, what new technique has been coming up day by day. And to receive that, we have to go for a research and scholarship in anatomy education. So what we started with the curriculum reforms to the assessment, to the faculty development, and faculty development is always research oriented. And whenever there is no research, the faculty development will not be in its true spirit. Because the major global trend is the rise of anatomical educational research in a literature, which is nothing but a scholarship of teaching and learning, but also for the upliftment of the medical society again. Because anatomists worldwide are publishing their articles in the various domains, like the learning, teaching and learning, how the students learn the best, effectiveness of the technology using the 3D models, using the AR VR tools, integration strategies, the assessment innovation, what the new assessment innovations are coming up. So these are the worldwide trends of anatomy publications. If you search any of the Google Scholar or any of the website like the PubMed or the Scopus or the Web of Science, that is flooded with the anatomy research based on all these only things. And various journals are also available nationally, internationally, that have become the part of a leading platform for research related to the anatomy education. And we have to be adapting this educational research platform. We have to go on this educational research platform, because without research, the reform will not come. From the research only we can accept that yes, this is good, this is bad. Whatever bad is there, that will come from research only. So in India, there is an increasing need of faculty to publish educational research, which is we are following. But just keeping the traditional research, like related to the cadavers, related to the bones, we have to move away. We have to integrate that anatomical research with some clinical subjects, surgical subjects. Radiological anatomy, surgical anatomy is the need of the organization. So this helps us to understand what truly enhances the students' learning and their academic promotion as well, for the student as well as for the faculty. So research and the scholarship in anatomy education is one of the again important thing. But to achieve these, all this curricular reform and all these things to the research, there are certain challenges and concerns. These are the challenges and concerns for adapting new trends in anatomy education. These concerns may be the global concerns, some may be the local concerns. So with the reduced dissection time, what I was talking about, a reduced tactile experience of the students, they are not able to feel the cadaver. They are not able to feel the difference between the artery and vein on the fingertips. So tactile experience is losing. Faculty adaptation, yes, many teachers are still uncomfortable with the many digital tools. So we have to adapt those technology as a faculty. There is the cost and accessibility involved with the technology. Not every medical college, not every faculty can bear that cost. Student overload with the curriculum of that whole, what there initially for 1.5 years packed into the 9 months now. So totally reduced to the 50% of total duration. That is also a part of a student overload. So information just without deep understanding is the main problem with the today's generation of students. There are ethical and emotional disconnect. The risk of creating the anatomy just as a digital puzzle. This is the most important challenge what we are facing. So considering all these challenges, we must recognize that while the technology offers the solutions, it can also create some distance between the teacher and student. Because if the teacher is not techno-savvy, students are already whether techno-friendly, it becomes a sort of a challenge. Students don't want to come to the dissection hall, don't want to touch the cadaver, but the teacher wanted him to do like that. Again, a part of a distance. So, between the student and a human body, between a student and a teacher, this distance has to be reduced, and this can be reduced by considering the initial 4 steps what I was talking about, from curriculum to the assessment to the research and the 4th thing again. So, when all these things are there, we know everything. We know कि वहाँ पे क्या है, वहाँ पे problems है. So we have talked about the 4 global trends. Trends है तो trends को solve करने के लिए अपने को drivers चाहिए. So we identified the 5 drivers: the reform, the technology, the reduced contact hours, ethical challenges, global collaboration. These are the drivers. There is a shift from the dissection to the digital. There is a role of dissection, which is important. There is a change in the assessment methods. There is need of faculty development, faculty collaboration. There is a need of more anatomical research. Now, with these challenges and concern, we have to take out with some of the solution for that. We have to come up with the way forward. And where do we stand today? We stand at a crossroad. It's a junction. It's a crossroad. It's a crossroad between a tradition of a rich anatomical knowledge, anatomical teaching on one side of crossroad, to the exciting future of what you can say a technology, a future of innovations in the further part of this crossroad. So we have to cross. We are in the center of that crossroad. जहाँ पे एक तरफ dissection है, additional dissection है, additional anatomy teaching है. एक तरफ there is a future of innovation and technology. And our goal is should not to choose one over the other. We have to integrate. We have to create the balance. We have to continue with the cadaver-based teaching wherever possible. Even if we are not getting 20 cadavers for 200 students, at least we should have 5 cadavers. Incorporate the technology meaningfully. Yes, if the 5 cadavers are there, how the student will learn the dissection? Then we can have some apps which can be run on Android mobile or the Apple mobile. We can have some app on just having a digital smart screen TV, which is not very costly, hardly 65-70,000. We gets a good touch screen TV. So we can run those apps on that. So student will get a feel of having the dissection. We have to foster the integration with the clinical subjects. Making the anatomy more clinically relevant, making more clinically sound. We have to encourage the research and collaboration among the anatomy faculty. And to keep the human touch alive in our teaching is the most important responsibility on the shoulder of all our anatomists. And as we celebrate this World Anatomy Day today, let us remember one thing: what we are, the study of the anatomy is not just the bodies. It's about the humanity. It's about a lively person, one person who was lively at one sort of a time, and now who is teaching the student as a form of a silent teacher. So, considering all these are the way forward, and we have to come up of this crossroad making the balance between the two, between the dissection, between the digital, between the technology, and between the rich traditional dissection or rich traditional anatomy teaching. So, to the conclusion, anatomy remains the cornerstone of medical education. No doubt of that. It's a foundation of medicine. How much the anatomy technology advances, wherever in the world technology advances, the 3 C's that defines our anatomy discipline will always be endurance to everyone. What are those 3 C's? Curiosity. It's a curiosity that brings a non-medico to the medical college, first to the dissection hall, dissection hall mein kya hota. Second thing is the compassion. It's a compassion among the student, among the faculties, especially the young anatomists who are now the future of medical education. They to be compassionate, and the commitment to the anatomy education is the most important 3 C's: curiosity, compassion, and the commitment that makes the anatomy as a discipline of cornerstone of medical education. So as a faculty, again, we are the bridge between the past and the future. What I told you initially, the guardians of the legacy that our shoulder has to carry in both scientific as well as the humanistic. We cannot say no to the technology. We cannot say no to the tradition as well. We have to merge them, and we have to be guardian of legacy for that. So let's continue to innovate. Let's continue to inspire and ignite the curiosity in every medical student, because I know the anatomy teacher is the true teacher, not only from the physics or the physical presence in the department, but also from his inner sense, from his mind. I know when the medical student passes first year, when he goes to the second year, you ask any student, what do you like? They will say, we like the anatomy first year teaching. Every student will say like that. Because the anatomy teacher not only are present physically, but they are also present emotionally with the student. They make the student feel as a student in the college. When they go to the second year, the most of the teaching is forgotten. And more they go to the third year, no teaching at all. So they are free to read. They are having everything is about the SDL, self-directed learning for the student. So that's why the student remember the anatomy teachers, because the anatomy teacher not only inspire the student, they innovate the student, and it should we continue with that. We have to ignite the curiosity among the minds of these young students to learn anatomy. So that's why every student has to walk into the dissection hall or through the virtual dissection lab, if it is available, to make them understand how the anatomy works, how the anatomy is important for the future of medicine. So this is the conclusion and reflection for my today's session. So as we celebrate this today's World Anatomy Day, we say Happy World Anatomy Day to each other. Let us remember the anatomy is not just a structure and the systems. Structure of artery, structure of vein, structure of human body or the system like that is not like that. It's a story of a life itself. Jahan pe every muscle, every vessel, every nerve is in the form of a story of form, story of function, a story of a balance. How the balance is made up, the human body teaches the balance. The beauty of human body is there. You have to identify that beauty, innovate that beauty. And when we talk about the teachers, as an anatomy teacher, we are the custodians of this story. We are standing at the crossroad. I told you the crossroad between the rich tradition of anatomy teaching to a future of innovation, future of technology. We are at there, and we have to make the balance between the two. So wishing a very happy World Anatomy Day to all my fellow anatomists, senior anatomists, and the young budding anatomists who are the true architect of the medical education. So this is only my message to everyone here. Let us continue to explore, innovate, and inspire the young birds through the anatomy. So wishing you a happy World Anatomy Day to each and every person present over today's this webinar organized by the Anatomical Society of Assam. And thank you to everyone. Hope so. I think that was from my side. Let us have some discussion with ourselves on a board where we can have every one of us.
Thank you so much, sir. Thank you so much, sir, for such an innovative and enlightening talk.
And I'm sure each and every one of us will agree that it was really nice listening to sir. It is actually always a delight to listen to you, sir.
Thank you, ma'am.
And actually, we will love to hear from you again later, because we would love to hear from you regarding a lot of other teaching methods from you, sir. Because we as anatomists have a lot of doubts regarding a lot of teaching procedures in anatomy, especially regarding small group teaching in anatomy. But today is not the right platform to discuss that. But now I think the participants will have a lot of reflections and questions to ask you. And I think, as Ruby ma'am had instructed at the beginning of this session, you must have put your questions in the chat box. And if not, you can raise your hands and we'll take up the questions one by one. And please remember to unmute yourself before you ask your question. I think Mobujiti sir has something to ask.
Yeah.
Yes, sir.
Yeah. Good evening.
Sir, good evening, sir. Please, sir.
Good evening, sir. I really appreciate these deliberations between the technology and this classical dissection. What I found nowadays, the students, they are thinking that although they are techno-savvy, that the days are changing, and this now will be in the age of this artificial intelligence. So now students are thinking that if they ask any questions, that will automatically come. And that is the big blunders they have made during exam. So rightly you have pointed out that classical dissection, without that, nobody can learn proper anatomy.
Correct, sir.
Yes, that is correct. That we must have this, what is called, that gadgets, that is okay. That is always helpful. But at the same time also this procedure of surgery. How many surgery now we have seen that this classical surgery, open surgery, almost this negligent, right?
Negligent.
So point is that this always I insist the students, if you don't come to the dissection, if you don't come to see the slides in your own eyes, you will not learn anything. That is a message from me. And always I insist them, please learn your own body first. Your superficial, learn your own body before. So thank you very much, sir. It's a very good. Another point I want to raise that this CBME curriculum is okay. On this, I don't have any objection on that. But regarding these questions, now say 10 marks questions are just like an objective type. So if they correct, out of 10, they are getting 8, 9, like that.
So, what I learned from the CBME since 2019, what I have seen, at that time I was under the Nodal Center of Chennai, Ramachandra Medical College, and now since last 5 years I am here in the Nodal Center of Wardha. I think ours is one of the most involved and most interactive nodal center throughout the India. I am not praising my nodal center because I am here, but what I have learned from other people also. But the CBME, the main crux of the CBME is not only the competency-based medical education, but the student-centered medical education.
Right.
So whatever initially was there, we used to talk from the teacher's perspective. Whatever I learned, whatever I prepared for my lecture, I used to go and deliver that to the students. But now it's not like that. It's more from the student side, what they want to learn. We have to decide just these are the competencies, these are the learning objectives, and these has to be taught to the student. So more about the student centricity is the crux of this competency-based medical education. That's why the assessment is also like that only, what you pointed out, sir, correctly.
Okay, thank you, sir.
Thank you, sir. Thank you. How are you, sir? Where are you right now, sir?
Right now, I am in Mizoram. Mizoram Medical College, Mizoram.
So when you left that UP, Uttar Pradesh over there?
I know that. I know that. I met you.
Yes. We
met in Bangkok, sir. Beams.
Beams.
Right.
Yes. Happy to see you. Happy to see you.
Sometimes I will call you to Mizoram.
Definitely, sir. You call me not only coming for inviting me, but also for anything.
Okay.
Call me, sir.
Okay. Thank you, sir.
Thank you, sir. Thank you, sir.
Okay, any other question? I think we have another hand raised from Sudipta Deepak Wardha.
Hello, sir. Good evening, sir.
Yes,
That was a really insightful talk. Thanks for that. And like you rightly pointed out, the limitation of these modern technologies, AR and VR, is that the tactile information is missing in those technologies, right? So I have a two-part question. The first part is that do you think haptics are going to help, tactile haptics embedded into the AR, VR to, getting a feel of the soft tissue is very important, especially for the doctors and also the surgeons, as well as for general physicians, how the body feels. With AR and VR, we get information about how it looks, what are the layers, but the tactile part is missing, like you said. So firstly, will haptics help in that? Second part of the question is that is there any place in India that you know where haptics are being incorporated into these modern tools to teach anatomy? So if you give us some insight into that, sir, will be really helpful.
Sir, I have to add to you, what you are saying is a perfect thing, the haptic work for VR, AR or the related tools. And we are having a good state-of-art simulation center at our university. Madam has seen, Shobana ma'am as well as the Ruby ma'am have witnessed that.
Okay.
Now, with that simulation center, AR, VR being a part of simulation, we have adopted it. But telling you the thing, 100%, the haptic feel of that live of that cadaver never comes on any simulation technology, never with any technology.
Okay.
Just putting the head eye gear and holding those two playable instruments in your hand,
Exactly.
You cannot feel anything, sir.
Exactly.
What that feel gives you, the holding the artery between the finger, between the thumb and index finger will never give you that haptics.
Yes.
And it is not available at anywhere.
Yes, sir.
There are n number of now AR, VR simulation companies coming up in India. Those are providing the AR, VR software. But the haptic is not that good.
Yes, sir.
We have tested many of them. We have tested few Bangalore-based, few Pune-based IT companies which are coming with the AR and VR. But they are just like that you are holding something in your hand and separating the layer with this like this, just moving up the layer.
Got it,
You
sir.
cannot do the dissection with a scalpel like this, or you cannot take out the fascia like this.
Yeah.
So they are not at all not 10% matching with the what real dissection takes place on cadavers.
Exactly, sir.
Yes, sir. So that your first question is haptics is out of thing. Second question was what the place in India where you can get a feel of that. So you search something or I will provide you the names of certain companies who are there.
Okay.
That will come to you college and that will give you the demonstration how to this they will give you the demo of using the AR and VR and giving the haptics and all that. You can learn from that, sir. Last month only I have taken one demonstration of one company. That was not an anatomy company, that was a surgery company.
Got it.
Surgical, laparoscopic and all these things were there.
Got
but
it,
the haptic do not work at all.
Got it, sir.
Picking up the instrument, like I want to pick up a scissor, I want to pick up a probe from the tray, that operation theatre tray. Just you have to take your hand to that and just put the button. That will pick up.
Yes,
you will not feel that anything.
True, sir. Yeah.
Yes, just like a game or a simulation can be thing. Nothing more than that, sir.
Yeah. Thank you, sir. Thank you for that.
Thank you. Hope you have been satisfied with that.
It is. We are, sir. Maybe hopefully we will see something like a Tesla suit where we have pinpoint accuracy on multiple pixels where we can actually get a feel of what the artery feels like between the fingers. Let's hope for that day. That's it.
In the month of March, there is one conference in Singapore. It's not an anatomy conference. It's a simulation setup conference. I have been visiting that conference in Singapore. And they have contacted us last week. They are putting up a new model of AR, VR for anatomy teaching.
Got it.
Right now, till today, very few pure anatomical teaching models are there in AR, VR.
True, sir.
Now they have promised they are in the final stage and they are showing up. So they wanted to have a center of excellence with our university. So I said, let's test first in a Singapore conference, then we'll decide on that, how the management goes on that.
Great.
So if that goes well, we'll be happy to share a first type of its AR, VR purely for anatomy teaching.
Great, sir. Thank you, sir.
Yes, thank you, sir.
Thank you, sir. Any other questions? If we have any other questions, we can take this opportunity to interact with Vaibhav, sir. Do we have any other questions?
If they have some question, they can send me a WhatsApp also. I am very happily available on WhatsApp also.
Thank you so much, sir.
I will be happy to help you if somebody or someone want to have some something to know or something to learn or something to tell me. I am always happy. I am always open for that.
Thank you so much, sir. So I have a personal question, sir.
Yes, ma'am, please.
So, sir, see, most of us are from government medical colleges, sir, and we do not have great access to technology, sir. And, sir, in one of your slides, you have very beautifully pointed out that we can make use of some very, minimal resources like a smart television. So, it would be very nice if you could share with us certain ways how to make use of those, minimal technologies and help students in explaining certain things rather than going for virtual dissection tables and all those sorts of high-end technologies, because we do not have access to all of those things, because a virtual dissection table is a very far-sighted thing for us. We do not have access for that. So can you help us with those kind of things, sir?
Yes, ma'am. On this same note, I would like to tell you there are certain screens available, touch screens available in the market, which are Android run, which are run by Android, just like our smart mobile. So, and you have to just download certain apps. The apps may be a free app, even if you search for some anatomy apps on your Google, not on the Google, on the Play Store, you will get so many apps. Some are the free apps, some are the paid apps. Some free app give some item free of cost, but most of the items are paid. Then only if you take the subscription, then only they will help you to give entire work through that app. So these apps can be installed on those TVs, smart TV, touchscreen TV, and can be just work just like a smart mobile smartphone what we use on the fingertips. So it's a very easy to use. One of the app has been developed now by LCVR also, Total Anatomy. So if you call any LCVR person over there in your region, who must be the representative of your region, Northeast
Yes,
region,
sir.
he will help you. Last week only LCVR person, he has asked us to purchase some LCVR app. He is ready to give some student subscriptions also, free of cost for 15 days or 10 days to use it. And later on, if the students are happy, they can purchase it. If your government setup is there, if your government approves it, then you can have a for department level also, for college level also.
Okay, sir.
And the advantage of this is that you can use it at both level, at mobile also and on the TV also, in department also. And individual subscriptions are also there. For example, 100 students are there, all 100 can make their entry into it, and that all that 100 can be seen, the progress of that can be seen also.
Okay,
It
sir.
becomes easy for teachers also over there.
Okay, sir. Okay. Thank you so much, sir. Thank you, sir. So I see a hand raised by Dr. Anjan Rajkot.
Yeah.
So Dr. Anjan Rajkot, you can ask your question.
Yeah, hello, sir.
Hello, sir. Hello.
Yes, and presentation is very well, and I would like to ask one question regarding the embryology part. So mostly we are using the models to
Yes.
discuss the embryology. And sir, do you suggest some other tools so that we can discuss the embryology with the students? So because it is difficult to prepare all the models in embryology, sir.
Definitely. What you pointed out is the very genuine and the right demand of today's anatomy education, the embryology teaching. Because traditional senior anatomists were very perfect in anatomy. I will also consider myself as a young anatomist. So people are not that expert in embryology. We have learned anatomy, but not that in depth. So what happens when we go for teaching anatomy through models or through the just through the PowerPoint, it becomes quite difficult to make the student understand. But when students see the same thing in a three-dimensional way, how the gut tube is formed, how it the anterior ascending limb and descending limb progresses, how it becomes a part of a physiological hernia, how it rotates through 180 degree, and how it gets reduced inside. That 360 degree visualization is only visible through either through that what we are having the anatomist table, where we can have a special type of projector come. That projector is called as a 3D projector, sir. So just you have to put that 3D projector on the screen and use the special 3D glasses, just like what we use to 3D glasses in the theater. Now, in that you can see the 3D rotation of that all these things. So that is a bit costly affair, because 3D projector will be needed. Special CDs or DVDs are needed for that. That runs the thing. The easiest way available is to go for the embryology animation videos on YouTube or some subscribe channel, like we have the Access Medicine with our institute. it's a McGraw-Hill product. Access Medicine is a McGraw-Hill product. There are certain very nice embryology videos in that. So what I told him, how that ascending limb enlarges, then how to descend inside with the rotation. So I teach that just like with the two hands of this and going the rotation like that, 360-degree rotation coming inside, then here developing the cecum bird developing into appendix. So all that is shown very nicely in those videos. So just try to see certain animation videos of embryology that gives a good understanding of anatomy for students, not only for teacher but also for students.
Yes. Okay. Thank you, sir.
Yes, sir. Thank you, sir.
So there,
Dr. Datta, ma'am.
there's another question from Dr. Malamani, Dr. Vaibhav.
Yes, ma'am. Yes, ma'am. Good evening, ma'am.
Malamani, could you just unmute?
Yes.
Good evening, sir.
Good evening.
It was a very nice presentation. We are enlightened so much to have such a wonderful discussion. Actually, this is not my query to you. It is just a discussion only.
Yes.
Like, sir, as you know, that's since 2019 we are following this CBME curriculum. And yes, there are many challenges we all anatomists are facing, but that shortage of cadavers, shortage of faculties in every medical college, especially the shortage of anatomists all over this one country. But the thing is that one plus point of the CBME, I have also seen that like students, it's not that they are not gaining the proper knowledge, they are gaining the acquired knowledge or that skill or competency based knowledge they are gaining. But the thing is that at the same time, I have through my last previous few years of experience, I have seen that the students are for the gross anatomy it's okay, but the thing is that regarding the histology part and the embryology, most of the students neglect this part. So can you suggest some techniques so that we can increase their interest, especially in embryology and histology? No doubt embryology is very tough for the undergraduate students, and that's also for only such limited period of time, 9 months. So we just want to do something so that they get some, their interest will increase a little bit to gain, because embryology is such an important, without understanding the embryology, they won't understand the anatomy properly. That's the thing.
So, ma'am, my crux of this, only one line answer for this is it's the assessment that drives the learning.
Okay.
So, in the beginning only, you have to inform the student कि yes, the histology, we ask 15 marks of question in our question paper. So
Yes.
तो से कि एक ही क्वेश्चन आता है, ये हम ही बताते हैं मैडम उनको. Teacher will tell them कि histology पे एक ही क्वेश्चन आता है, that's why they are not worried for that. If you tell them कि 15 marks का question आता है, it's a part of a long question also, it's a part of a short answer question also, it may be a pure BAQ also, brief answer question for that. Then only the students start working on that or start listening to that. And second thing is we have to make the correlation of the histology with their pathological finding or with their surgical thing. How that on histology, some person is diagnosed to have a CA of the stomach, cancer of the stomach. So if somebody tomorrow is going to work as a endoscopic surgeon or some laparoscopic surgeon, वो जब उसमें cancer of stomach identify करना है तो उसको मदद कौन करने वाला है, तो pathologist. And being a pathologist, you must have a thorough histologist first. तब तक पैथोलॉजी नहीं होगा, तब तक के पैथोलॉजी उसका आपको नहीं आएगा, पैथोलॉजी नहीं आएगा तो आप रिपोर्टिंग नहीं कर पाओगे. You will not be able to save a life of one patient if you cannot give a proper diagnosis. So when is the student scenario what started from histology to pathology to endoscopic surgeon or laparoscopic surgeon, at least 10-15 students will get motivated to learn histology.
Okay.
Majority of the students will be happy to know कि yes, इसमें question आने वाला है तो ये मुझे पढ़ना है बस. That is the most important driving force for any of the learning among the students.
Yes.
That's what I feel. What additional you can suggest, I will also try to inoculate in my routine.
Yes, sir. If you get some any innovative ideas, do share with us.
I have noted your point. I will also work on that. How can I make it more interesting for student or more calling for student?
Yes.
Yes, ma'am. Thank you so much, ma'am.
Thank you so much, sir. Thank you.
Okay. Thank you, Malamunima. So with that, due to lack of time, we'll not be able to take any more questions. Thank you so much, sir. With that, I'd like to request our treasurer, Dr. Amarjyoti Bora, to kindly present a vote of thanks and to end this webinar officially. Thank you so much, sir. So over to Dr. Amarjyoti Bora.
Thank you, Sunna ma'am. So here we come to the last part of the session. On behalf of the Anatomical Society of Assam, I extend our heartfelt gratitude to our distinguished keynote speaker, Professor Vaibhav Anjankar sir, for his enlightening and inspiring talk. Your valuable insight on global trends in anatomy education, where do we stand, have truly enriched today's celebration and provided us with much food for thought. Our sincere thanks to all the faculty members, students, and all the participants who have joined us in celebrating World Anatomy Day 2025. Your active participation and enthusiasm made this event both meaningful and memorable. A special note of appreciation to Professor Ruby Saikia ma'am, President ASA, and Dr. Subna Meghe ma'am, General Secretary ASA, for taking this wonderful initiative. It is indeed a proud and historic moment, as this marks the first ever celebration in World Anatomy Day under the banner of ASA. A truly welcome step towards uniting and the anatomy fraternity of Assam with the rest of the nation and the world. We also express our sincere gratitude to Dr. Sudipta Deepak Barua from the IT cell, ASA, for his excellent technical support and seamless coordination, which ensured the smooth conduct of the webinar. As we conclude, let us continue to strengthen our bonds as part of the global anatomy community, working together to advance anatomical education and research. At last, wishing everyone a very happy World Anatomy Day 2025. Thank you. Good night.
Thank you. One request from my side: if most of the people, if can they start the their videos, I will take a big screenshot so that it will be a part of my memory.
Yes, sir. Yes, sir.
Association with my association with Anatomical Society of Assam.
Yes, sir. Yes, sir.
So
Definitely, sir.
if
Requesting everyone to kindly switch on their videos. Dr. Sudipta, Dr. Anjan.
so whosoever, because it's a, I know it's a family time for everyone, but still if we at least some people can start, so that I will take some screenshot. I will take a screenshot.
Yes, sir.
Yes.
Arupuna, sir.
Yes, thank you, ma'am. Thank you. I have taken a big screenshot. I will share with you also.
Yes, sir. Thank you so much.
Thank you. Thank you, everyone.
Thank you, sir.
Thank you, everyone. Thank you, office bearers of the
Thank you
association.
so much, sir.
Thank you, everyone.
Anatomical Society of Assam, for giving me this opportunity. Thank you so much. Happy to have good words of discussion. I will not consider myself as a speaker, but as a part of a panelist where other people also contributed. They also give their input for that. Thank you so much.
Thank you, sir. We'll love to have you again, sir.
Yes, definitely, ma'am. I will be always there, happy to share my knowledge, my words, my experience with you people online anytime and offline also.
Thank you so much. Thank you so much.
Yes, thank you, everyone. Thank you. Good night, everyone.
Thank you. Good night.
Thank you, sir.